So, quick update back from Astro. PARTIQol was presented this year. This was a study of proton versus photon therapy for patients with low risk or intermediate risk prostate cancer. It was done by the experts, the people at Mass General, Penn, and some others you see here. So if anyone was going to find a difference, it's going to be these people. As you can see here, about 40% were low risk patients. And it's also interesting to note that half the patients got rectal spacer, about half the patients got hypofrac, and half the patients got pencil beam scanning. So they were able to adjust to advances that were occurring in the treatment of prostate cancer. But when you look at it, and the primary endpoint was patient-reported outcomes with bowel symptoms by EPIC, there was no difference. They also presented a bunch of other endpoints that I summarize here. And again, all these additional endpoints showed no difference between proton and photon therapy. So in conclusion, they found that patients with low and intermediate risk prostate cancer do very well without any real difference between the use of proton or photon therapy. This is what I learned from this trial. The investigators should be congratulated for performing this. It was not an easy study to get done, but in this disease, in this clinical scenario, protons equal photons. There's going to continue to be much debate about the two, but there's one thing that has to be pointed out is that photons have gotten much, much better. And I do think adaptive therapy shows great potential and is probably going to be the future in all of our clinics very soon. Sometimes I wonder if this is a fair fight, or is it a fair fight? Because there's a dosimetric difference between the two, but there is not a biologic difference between the two. Stay safe and see you soon.